Yes, I'm Monica Soni. I'm the Chief Medical Officer at Covered California, and I am a practicing primary care doctor. Covered California is the California state-based exchange. It's essentially Obamacare, and we cover over 1.8 million Californians.
Amazing. Excellent. I'd like to learn a little bit more about that because, the American healthcare system operates quite differently to the Australian healthcare system. Good mix of listeners across Talking Health Tech in both the US and Australia. But tell me a little bit more about what makes Covered California a little bit unique and how it fits in with the healthcare system.
Yes, we have a very complicated system in the United States. But I will say that post the Affordable Care Act, or Obamacare, Covered California or the state-based exchanges filled an important gap. So if you get into your insurance through your employer, great. If you're low income, we have Medicaid, our coverage through that process, and we fill the gap. So we're for folks that aren't low income enough to get Medicaid but don't have coverage through their workplace. And that was millions and millions of folks in America who actually couldn't get insurance in any other way. So we are the marketplace. So folks can come on and shop for commercial or private insurance. And in California, we're actually an active purchaser. So we make sure that the quality of care that they get, the plans that are available to them are really high quality.
Interesting. And I guess like that, in terms of the why, I would imagine then, a big issue globally, but particularly in the US, is ensuring that as many people as possible can have access to good quality healthcare. Is that right?
That's exactly right. And that it's not confusing. So when you choose Plan A or Plan B, are you still going to be able to see a primary care doctor in an affordable way? Can you get your diabetes medication for as little as possible? We make sure that it's actually standard benefits. So all you have to shop on is which provider do I want to see? Which brand name plan do I want? Not navigating a bunch of other benefits.
Yeah, got you. And it's government?
It is government, yes.
It is government. So what brings you to an innovative healthcare conference like this?
Yes. So, even though we're government, I like to say that we're very innovative. Covered California was essentially a startup, right? The regulation passed out of DC. And then 10 years ago, we were invented. And really, nobody knew if it was going to work or not. So we actually have a lot of unique provisions at Covered California to protect our consumer, to make sure that they are getting that care that they want. And we do a ton of interesting stuff around generative AI, around quality, around equity, financial accountability, thinking about our consumers first, human-centered design. All of this is happening under the umbrella of government.
What would some of those, say, more innovative technologies, because on the surface it might be just ensuring that people can have access to a different coverage when they kind of fall through the gaps, but how can utilizing some of these cool technologies further assist in what you're doing?
Yeah, absolutely. The first thing is that our platform is super easy to use. So folks can come on, answer 4 questions, and we can actually direct them to the best health plan for themselves or for their families. The other thing is when you come on and give us pretty basic information about your income and what your healthcare needs are, we can tell you what other benefits you might qualify for in the state of California. It's a little bit of a clearinghouse as well. But sometimes that means not coming to us. It means getting insurance actually through our Medicaid agency, and we can facilitate that too. We have automatic enrollment from our Medicaid agency to Covered California, so all this back-end processing. And then the other piece is our service center, which is where folks can call in, is really state-of-the-art. Again, meant to be a, very human-centered approach. We have chat bots. So all of it is, however you want to enter, whatever door you want to come through, we make it easy for you to get what you need.
Yeah, interesting. And so I understand you're on a stage during Health. You're presenting some stuff. Tell me a little bit more about what you're talking about.
Yes. So I'm presenting Redistributing the Healthcare Dollar, which, again, because of the financing in the U.S. healthcare system, super difficult. We don't pay for prevention. We mostly don't pay for wellness. We pay for sick care. And so we at Covered California, of course, if you have chronic conditions and you have needs, we want to make sure that you're getting those needs met. But frankly, we're thinking about how to take dollars away from our health plans and putting it back into community and back into our consumers and our members.
Yeah, amazing. And so I imagine there'd be opportunity for other government systems to think differently about what they're doing. What would you hope that perhaps other healthcare, it doesn't matter what it is, healthcare institutions, payers or other parts where otherwise it might feel like innovation might be difficult to get over the line? How can you kind of get those first wheels turning?
Yeah, great question. So I think first of all, it's to be unafraid. So, we did things like making sure that we asked about race, ethnicity, other demographic information, sexual orientation, gender identity up front in the flow of our application. So now we have this incredibly rich database, which we can combine with utilization. And so actually with surgical precision, decision, we can say, we know this population is not getting the care that they need or doesn't have the coverage that they need. So that's one piece, is actually being forward thinking about data and data collection and how you leverage that and do data exchange. And then I think the other part of it is financial accountability for the partners. So we have very progressive contract requirements for our health plan partners, as I mentioned, around quality, equity, access, even around use of generative AI, to make sure, again, that we are pushing that really cutting edge of what it means to have high quality, equitable, accessible care.
Yeah, amazing. There's a bit of a balance too, isn't there? I guess a constant theme I hear about is the need for all the different stakeholders to kind of come together, to collaborate, to come up with solutions. Sometimes that means that, for someone to get, another side has to give. How do you kind of come up with arrangements where kind of, I guess, everyone wins to ensure that patients receive the best quality care?
That is a fantastic question. Maybe I'll share that there are other public purchasers in the state of California. I mentioned our Medicaid agency. There's another one that employs state employees. The three of us have aligned, and we actually represent over 45% of all Californians. And we're a gigantic state, as you know, right? And I think it is a give and take, right? We, for example, have a lot of focus on childhood wellness and maternity, not because we actually have a lot of kids. Most of those are covered through our Medicaid agency. We don't have a ton of births. Most of those are covered through our Medicaid agency. But we think about the good of California. Actually, our vision statement is not about just our enrollees. It's actually about improving the health of all Californians. So implicit in that is this idea of compromise, right? What's the long-term vision for all of us?
Yeah, amazing. Any other final thoughts or things you're most looking forward to here at Health, other than getting a petunia stuffing over there?
I'm going to go do that. But also, it's just been amazing to see folks from all different parts of my life. I saw someone from my high school, someone from my medical school here, just doing really fascinating and amazing things. And I think to your last question, if we actually think about ourselves as a collective, that we're not competing for resources, we don't have scarcity mindset, just think what we can do and unlock.